A very warm good morning to one and all. It gives me immense pleasure to welcome you all to the 13th talk of TransPedia Research Talk Series organized by KSCSTE National Transportation Planning and Research Center, NATPAC. This series is yet another unique venture of NATPAC designed to explore diverse topics from cutting-edge technologies to sustainable solutions. Here we will be featuring eminent young researchers to share their valuable insights for kindling the spirit of future research and development in transportation. Today we have with us Dr. Laxman Singh Bisht, Assistant Professor, Center of Excellence in Safety Engineering and Analytics, IIT Kharagpur, for sharing his valuable insights on the topic, recommendations for LMICs based on road safety science principles to realize the global targets. Now I request Sri Anish Kini, scientist, to deliver the welcome address. Sir.
Thank you. Am I audible?
Yes, sir.
Yeah, okay. KSCSTE-NATPAC has launched a technical discussion series called TransPedia Talk Series, which is envisioned to promote research for shared benefits by disseminating knowledge on diverse topics from cutting-edge technologies to sustainable solutions. Desirably, this also brings out a platform for young researchers across the globe to connect and interact to better shape the future of research and development in transportation. The inaugural talk of the series was conducted on 24th August 2023 through online platform, where more than 200 participants from eminent institutions, departments, etc. attended. The inaugural address was given by Professor Dr. Tom V. Matthew, Chairman, Research Council, KCST-NATPAC, and Professor at IIT Bombay. This monthly talk series has successfully completed its first year, featuring 12 speakers who covered a broad range of topics in transportation engineering. The 13th talk in the series will be delivered by Dr. Laxman Singh Bisht, Assistant Professor, Center of Excellence in Safety Engineering and Analytics, IIT Kharagpur. It is with great pleasure that we extend a warm welcome to our distinguished speaker who has graciously accepted our invitation to share insights and knowledge on the topic, recommendations for LMICs based on road safety science principles to realize the global targets. After the presentation, we'll have a question and answer session where you can post your questions and engage in a meaningful dialogue with Dr. Laxman. Feel free to participate actively. Thank you.
Thank you, sir, for the welcome note. Now, I would like to invite Dr. Vasudevan N., Junior Scientist, to introduce the speaker.
Good morning, all. Today we have Dr. Laxman Singh Bisht, Assistant Professor, Center of Excellence in Safety Engineering and Analytics, IIT Kharagpur. Dr. Laxman completed his PhD from Indian Institute of Technology, Delhi, under the supervision of Professor Geetam Tiwari in 2022. Prior to joining IIT Kharagpur, Dr. Laxman held the role of a postdoctoral researcher at Delft University of Technology, that is TU Delft in the Netherlands. His expertise lies on safety of rural highways in India, safety and mobility issues in low and middle income countries, and vulnerable road usage safety and safety data analytics. With this note, I welcome Dr. Laxman to this talk series. Thank you.
Thank you, sir, for the introduction. Now I invite our distinguished speaker to deliver the talk. Over to you, sir.
Yeah, thank you very much. Thank you for introducing me and inviting me to deliver this talk. I would like to start and share. Please let me know if you can see my slides. Is it in slide mode?
Yes.
Okay. Once again, thank you very much, and good morning to everyone. And as we know that today we will discuss what are the issues, road safety issues in low and middle income countries, and how we can improve them based on the road safety science principle to meet the SDG target 3.6, which is to halve the road traffic death by 2030. So in this talk, I will start the discussion with the what is the current status according to the latest global reports and statistics especially in low and middle income countries, and then I will discuss what are the major issues in those countries, and then I will move on to discuss about the recommendation based on the road safety principles, and I will present a case study how the paved shoulder width effectiveness can be measured in especially in the Indian scenario. So let me begin with the current road safety status in low and middle income countries. So this is a map. So the low and middle income countries are shown in the dark purple, light purple, and light green color, and rest of the region you can see on the map, which are indicated in dark green, are the. So this is just to set a context so that we don't get confused between the regions. And so a recent global status road safety report of WHO shows that almost 92% of the road traffic deaths occur in low and middle income countries. And this we hear across the different platforms whenever there is a discussion of the road traffic safety and the burden. So the one of the fact is that the 12% of the total roads in such regions is unpaved, or which indicates that the design of those roads is not as per the user's expectation, which we could say that it is one of the major risk factor or the challenge to improve road safety in such areas. Another interesting fact about the low and middle income countries is that within the low and middle income countries, the risk of death varies, which I will also show in another 2 slides. But the bottom line here is that in the amongst the low and middle income countries, the low income countries have the highest risk of deaths. And when we want to have a comparison with high income countries, so we could say as per the statistics, that it is almost 3 times the risk of deaths in high income countries. Now this graph shows that if we want to compare in terms of the absolute number of deaths on roads, so so within the different regions there is a variance when we compare different countries. So for example, in African regions, you can see that the low income countries, which are indicated in yellow, have a significant proportion. And similarly, the low and middle income countries also have significant proportion. And when we see the statistics for the Southeast region where India lies, so here you can see that lower middle income countries have significant proportion in the absolute number of deaths compared to the other income levels. So, and also when we aggregate these all data globally, so we could easily see that the low and middle income countries have the significant proportion in the total deaths compared to the the high income countries. So in a way, we can say that within low income countries, there is a lot of variation. And sometimes we should also point out that the income levels cannot be taken as an excuse for having a terrible or bad road safety scenario in the country. This I will explain in one of the slides in a moment. Now, when we compare the deaths with respect to the fatality rate, which is total number of deaths divided by the population, 100,000 population, so that this rate is taken as a burden of disease due to road traffic crashes, and it's a indicator to compare different regions logically. So here you can see that within the low and middle income countries, there is huge variation. So for example, if you take this Southeast region, so the low income countries, again, which are indicated in the in the yellow color, shows the highest death fatality rate. compared to the rest of the income level, which is lower middle and upper middle. Similarly, in case of African region, you can see that this variation is also significant. And when we talk about the European region, which are mostly the developed nations, especially the Western Europeans, you can see that even though there is no low income countries, but still there is a significant variation in the the fertility rate based on the income level. So we understood that from this we can understand that the road traffic issue is a complex issue, and it should not be just wise to compare or to say that income levels are could be one of the reason for the low income countries not to have a better roads or safer roads. Now, so let me give you an example. So these two countries, we all know them, that both of them are the high income countries. But if you compare the long term trend, so when we want to have a compare, so we cannot compare it based on the short term trend, but we have to rely on the long term trend. So for example, here in the graph on the x axis, you can see that this is almost 2010 to 2020, which is almost a decade of trend. So here you can see that the trend of road traffic deaths in both of the countries are in opposite direction. So in Japan, the long-term trend shows a declining rate, whereas in the United States, the long-term trend shows a positive rate. So this example very nicely explains that income levels are not always necessary to justify the bad road or the unsafe roads conditions in a nation. So in a way, it indicates that we need to have a multi-pronged improve what could be the principles for road safety improvement. Now, another aspect of why road safety is having huge consequences on the low and middle income countries. Easily understand this from the economic aspect, and when we want to have the economic comparison or consequences of the road safety measure, so we can estimate that based on how much of the GDP we are losing due to the burden of road safety. So this graph very nicely presents the distribution of the global burden, the burden of disease, the burden of disease of roads, deaths of road safety. So you can see that the proportion of the gross domestic product is varying across the region, but in case of the low and middle income countries, the burden is almost 7% of the GDP, which is a significant amount for the countries like India or low income countries, where there are multiple competing issues for the improvement. So this high number could also be due to that the one of the major share of the deaths occurs in the productive age of the population. So that could hinder in the economic development, and this also we can link to the poverty of a nation. Many studies nowadays are linking the impact of road safety on the humanitarian aspect and also on the equity aspect of the deaths, the impact of deaths on the different population within the nation, within the society, and the different strata of the society. So this we need to understand, and why this is important, because when we want to set the priority, so we must know how much economic effect the issue or the like for example the road safety issue is having on our nation. So now let me move to what are the major issues in the low income countries. So far I have discussed what is the current status according to the latest data in the low and middle income countries. But now let me discuss what are the issues. So we know that the low income countries has a very unique crash pattern. So unique, I mean to say, is that it's different from the high income countries, where we know that it's a car dominating society, and the crashes distribution are different. So this I have taken from one of the latest study by the Mitra and et al. So here they have done this study in the 6 low and middle income countries in the different regions of the globe. So and this statistic is based on the hospital data, not based on the police data. So here you can see that the majority of the road deaths are related to the motorcycle users, which are power two-wheelers. And also you can see a significant proportion of deaths are associated with the auto rickshaw users. And we know that how much important are the auto rickshaw especially in the low income countries and especially in the Southeastern Asia region. They fulfill the demand of the feeder trades. They fulfill the mobility need of the lower income strata of the society. So this is a very unique pattern when we want targets of the roads policy or plan. So we should know that where should we have intervention, what kind of intervention we should incorporate in the road safety policy and plan. Okay, so this example is from the rural roads, and this is for a 4-lane divided highway. So again, this is a rural highway, so we expect a very different crash characteristics pattern. But interestingly, and you must be aware that the even on rural highways, the vulnerable road users are at the high risk. So this graph particularly shows that the motorcycle users are again at the high risk when we compare the total aggregate crash data. Interestingly, in case of rear-end crashes, also the motorcyclist user were also at high risk. Another interesting fact was that the pedestrian were also at high risk in the highways. So when you compare the rural highways of the high income countries, so this particular road user you would not see on their death statistics. So in a way, what I want to suggest here is that when we want to implement the intervention, so we should not simply copy the interventions or the policy from the high income countries to the low and middle income countries. This we can reflect and understand from this graph. And also cyclists are significantly present in the road deaths data on rural highways. Now, again, when we look at the global scenario, so this confirms to the global level scenario. So in most of the low and middle income countries, you can see that the vulnerable road users have the significant proportion. One of the interesting fact we have to understand through this distribution is also that how the data is recorded and what is the different levels of underreporting in the data. That I will discuss in the next slide. We know that these are the the vehicles which are emerging in our on our roads. So for example, these are jointly called as power 2 and 3-wheeler vehicles. So before the 2023 report, the power 2-wheeler vehicles did not include the e-bikes and e-scooters, but now the definition has been expanded and the new emerging vehicle types are included in this the recent version of the report. So again, this also shows that the motorized two-wheeler globally, when we compare the global, when we have the global scenario, have the almost 30% of the deaths are related to motorized 2 and 3-wheelers, and pedestrian deaths is again significant, which is almost 23% of the total deaths. But when we specifically look into the Southeast Asia region, which is where the India also lies, so here the motorized two-wheeler and three-wheeler deaths is as high as almost 43% of the total deaths. Now, World Health Organizations have denoted almost 5 major risk factors of the crashes, so which are speeding, drink driving, motorcycle helmet use, seat belt use, and child restraint system use. So these are the major risk factors which have been identified across the globe. So these are not just for the low and middle income countries. But let's understand, because through the literature we know that speeding or the speed is one of the major risk factor. So let's understand what is the status of the speed laws in the low and middle income countries. So this graph represents the global distribution of the urban roads speed limit. So here the speed limit for the urban road is 50 kmph. So the green region indicate that where the the urban roads limit is less than 50 kmph, whereas the orange region also indicate that they also in some loose sense implicate or use the speed limit of 50, less than 50 kmph, but the red regions where they don't these countries do not follow the urban roads speed limit of 50 kmph. So why this is important? Because recently the debate is also to have the urban road limit less than 30 kmph, because we know that the speed is one of the important factor, and the what is the human body tolerance for the different speeds. So different studies have shown that the 30 kmph above 30 kmph the probability of deaths or the fatalities increases exponentially with respect to the human body. Now, when we understand the data related issue, so one of the major issue is underreporting. So this is very common, very high in low income countries. So you can see that in low income countries, almost the underreporting rate could be 84% compared to, and whereas in the middle income countries it could be 51, and in high income countries 11%, it would be 11%. So this again shows that how the underreporting varies across the region, and within the region, the low income countries have this the highest underreporting rate. Now, next is data discrepancy. So this is one of the graph I have taken from the MOD 2021 report. So this is the official data. So here you can see that the official data indicate that 19% of the deaths are related to the pedestrian. But when we compare this with the other studies which are done independently, but here one of the important thing to note is that the data source are the same. So there is no variability amongst the data sources. So the other independent studies done shows a different picture. So for example, the IIT Delhi studies estimated the pedestrian deaths are almost 33% of the total deaths, whereas the other independent research such as the Hashio et al. In 2013, which is also known as the million death study in India, and then Dandona et al. They carried out in 2017. So they also showed that what the government data is showing is inaccurate compared to the what actually the data is present. Or so this could be due to the data coding. So how the police data personal code crash, whether it's fatal crash or the other crash. So in a way, this also indicates that we must have a rule book how to code the crash data also for the police officials, and we should timely train them to record the data consistently. Now, when we talk about the rate of understanding, so we also understood through the literature that the rate of underreporting also varies based on the different road user type. So if you compare, observe this graph, so here you can see that, and this graph is for non-fatal injuries, and this is a data from hospitals and also from the police. So here you can see that when the crash is related to a motorized vehicles such as car or jeep and heavy vehicles, there is not much difference between what is reported in the police and what is reported in the hospital. But when you compare this data with this difference in the for the vulnerable road users, so here you could see that the difference is there is a significant difference between the hospital data and the what the crash is reported to the police. So you can now understand like how the previous graph make sense when you understand this pattern. Because, and the other reason also is that because in the for the vehicles related crashes, there is claims associated, insurance claims that are associated. Now, let's also understand like what are why there is sometimes also non-reporting of crash, because then we do not all have the real statistics of the crashes. So this study also this study was done in Hyderabad, and they asked the crash victims like why they did not register the crashes in the police. So it is very interesting that in the hit and run cases, the most of the victims they felt that it is not necessary to report the crash to the police. And also sometimes in case of the fatal hit and run crashes, where we have seen that the majority of the time the victims are the pedestrians, and such pedestrians belongs to the lower income strata of the society. So there is high chances that those crashes or those crashes are not reported to the police. And second, the victims also believe that they felt that it is not important or not necessary to report the crash. So this could also reflect the policing or the how the crashes cases are dealt in the police and then subsequently on the in the court. And other significant factor is that when there is a minor injury, minor crash, or which does not lead to the hospitalization, so in such cases the settlement is between between the two involving parties. And then there are other reasons also why the victims felt not report to the police. But this shows that we lose a lot of data when we do not report the crashes. And when we read the different statistics, like what is the how's the fatality rate or the fatality in terms of absolute number are varying across the years or decade. So we now need to understand that there could be various reasons for underreporting, various reasons for non-reporting in our crash data. Now let's talk what could be the way forward. And so this I have, as I told, that these recommendations would be based on safety science principle. So now let's understand that how safety has been evolved over the time, and what are the understanding associated with the safety. So safety, when initially it was talked about, so it was mostly based on cause effect relationship, and it was the reactive approach. It means that we are collecting the historic data and then we are analyzing and finding out the root cause. But now the recent the understanding was that the finding the root cause is not always an appropriate approach, and it could not be as effective when we compare with the proactive approach. So in safety one, the researcher or the scientists used to rely on what goes wrong in the road transport system or in any system where the accident happened. But in the safety two, the scientists now focus on what goes right. So it means that once they entered in the maximum performance variability of the system. So that is the high reliability systems. So this is kind of, you can understand that it's a proactive approach. But there was a significant gap in also in this approach, that we are not learning from the crashes, even though, and also we are not understanding how the complex system like road transport system and its elements are interacting with each other, how they are intercoupled. So the current approach, which is in a way indicated from like safety 3, so it says that when we want to deal with the road safety, so we need to understand that road is a complex system, and the accident can happen due to the failure of or the mismatch between the interaction of different elements of the road system. So now let's understand how the road safety science has progressed over the year. And this example I have taken from the US data, which is showing a long-term trend from 1900s till 2016. So you can see that there is a significant change in the trend road deaths after post 1970. So let's understand what could be the reason. So before 1970, as you would have understood now, that the measures or the understanding of the road safety was based on the engineer's judgment or based on the folklore. So what society thinks that why this crash has happened. So it was not taken as a science. But after the 1970s, the road safety shifted from the folklore to the science in the science direction, because now the way the road safety dealt was changed, and it was based on the data, it was based on the evidences and empirical analysis. So this was a significant change in the road safety science. This graph highlights that. Now, also understand like why, what are the different measures we should take at the institutional levels, so that we can reach to the global target of by 2030. So this, let's understand this from the trends of the various high income countries. So again, this 1970 onwards, we could see that the most of the high income countries following a downward trend, whereas in previous to 1970s, it was an upward trend. So before 1970s, these were some of the measures, like the road interventions were based on the finding the human error, the driver's error, and blaming for most crashes. So you frequently hear in the news that okay, it's the crash has happened because of the driver's error, or the pedestrians was jaywalking. So such terms were introduced and discussed, like it's not fault because of a system, but because of a human error. So the interventions were focused on education, on educating the driver, then black spot, finding the black spot, and then treating them, and then heavy fines. But after 1960, there is a change. So it was understood that we need to establish an independent agency who is legally supported and who has the full funding. And then after that, there were also the establishment of research center in such countries. And there were subsequently the different effective measures were taken. For example, the road designs were improved or changed for safer road. Then there was an introduction of mandatory seat belt, helmet, and the random and the frequent alcohol checks and the speed checks. So this indicates that we need to not just on we need to not just on rely on one measure, but we have to take the multi-pronged measures to tackle the road safety issue. Now, let's understand why the policy formulation is very important when we want to change the trend of long-term trend of the road traffic crashes. So this is the example I have taken from Norway, and Norway, we know that it is a global leader for road safety. So in 2001, they have adopted the Vision Zero policy, so which means they do not accept any deaths on their roads. So this was adopted by their parliament after the much discussion. So you can see the significant change. So even though the trend was downgrading before the 2001, but after 2001, you can see that the trend rate of decrease has increased. So it was a significant change. So this I took this example to set the tone that policy formulation is the need of many low and middle income countries, and you can understand from the national discussion right now that where we are lagging, right? Now, as we know that these are the three major elements of the road transport system, and I discussed like why how we understood road safety as an issue. So it's a systems issue. So the major elements are road infrastructure, vehicles, and road users, and their interaction. Now, what are the different roles of these different elements? That should also be clear and understood when we want to recommend any measure. So for example, what is the role of a road? or a street. So it should be it should support the correct use of a road user, and it should be forgiving and self-explaining and so on. So in a way that it should not lead, the road should be designed in a way that the crash should not lead to the severity. And second is the how the vehicles are designed, what could be the interior of the vehicles, how the frontal side and the other elements are designed in the vehicles. Similarly, what should be the expectation from the road users? What are the different behavior we expect from the road users? So when these all elements interact, and then as we know that speed is one of the significant factors. So how the speed limits are set within the urban regions and within the rural regions when we had different context. So this is a way we can understand that the overall interaction of a system should be designed in a way it should lead a safer road system. When we talk about the road safety, so now there is a discussion about the lot of discussion about the how to manage the overall road safety. So we know that the end objective of the any road safety management is to minimize the accidents and to maximize the output, which is to maximize the mobility need of the users. But how to do that? So through this graph we can understand that there are different levels of the road safety management. So what is the role of the management, institutional management? What should be the coordination between the different stakeholders? What should be the policies, the acts and laws? And from where should road safety should get funded? Who should fund it? Whether state government should fund it or the central government should fund it, or how or we should bring the external funded, and how it is and how the road safety is promoted in the society and also in the top management levels of the different organizations. So these are the institutional requirements of the road safety. Now when we talk about the intervention, so what should be the planning process, and how the safety is incorporated in that stage, and what are the how the safety should be introduced or be incorporated at the different stages of the road's life. And again, so the output that we expect to way to indicate the may I know how many minutes are left? Okay. We know that there are different road safety pillars. So these are the 6 pillars we have understood so far. So the road safety management, safer roads and mobility, safer vehicle, safer road use, and post-crash response. And then speed is the overarching pillar. Similarly, road safety management is the overarching pillar. So in a way, these 2 pillars regulate or could be incorporated in all 4 the vertical pillars. Now let's understand how what are the different enforcement measures we can take in the pillars, and how they should be supported in terms of the regulations. So for example, in case of the road design, so what should be the standards? So what should be the, let's say in the context of India, what should be the safer standards for the roads by the Indian Roads Congress, which is IRC. And then when we talk about the enforcement and the what should be assessment policy, inspection policy, and what should be the frequency of the road safety audit, should know, and what are the different stages of the road where in that we need to conduct the road safety audit. And also when we talk about the education, so what kind of the education policies or the education programs should we have for the engineers, so that they incorporate the design the safer roads design at the design stage. Similarly, at the different organization level, at the higher level, how the policy maker should be sensitized for the safer roads. And when we talk about the technological intervention, then how should we design the roads so that it is forgiving and self-explaining, and how we can incorporate the intelligent system to achieve the safer roads target. And one of the important aspect in this framework is that all the interventions should have a regulatory support. So in a way that is respected by all the stakeholders, and also it will be easier to enforce those interventions to design the safer roads. And can think about the like safer vehicles and effective post-crash care response. So what I want to indicate from here is that not just the interventions are important, but also how they are implemented, and what is the legal support to implement such interventions. So usually in the low and middle income countries, we will find out that there is a mismatch between these different levels of the framework. Now let's have an example like how so I talked about the 5 road safety the risk factors, and this is a very simple example how we can in a low cost effective manner we can reduce the traffic deaths and crashes. So let's say we first implement this seat belt. So these different numbers indicate the proportion of road traffic deaths in the total. So for example, 50% is the number of deaths related to pedestrians. So if we implement seat belts, so it will help the car users that's a reduction. So if we implement seat belts, so we expect, let's say we expect 10% of the reduction in the car user deaths. And when we implement helmet use, so again, helmet is the intervention related to motorcycles use. Nowadays, there is a discussion in the Western European that the cyclists should also use the helmet, because their recent statistics indicate that the cycling deaths are increasing. So they want to implement the helmet for cyclist user also. But let's stick to the low and middle income countries case. So let's say the helmet has been enforced. So we save almost to certain percentage of the motorcycle users. Now, when we implement the mandatory daytime light in the motorcycle users, so in a way we make them more visible for the larger vehicles compared to them in size. So we also expect that this intervention would reduce the motorcycle deaths. And speed checks are done frequently. So this intervention will definitely help the vulnerable road users, reduction in the deaths of the vulnerable road users, but also the motorcycle users and the car users. And when the alcohol checks are done randomly or at the different location, so we also expect to have reduction in the deaths of the all road users. So this is a very nice example that we don't have to wait for the very high and or the cost intensive measures to implement and then wait for the. But this example shows that we can have measures at a very low cost. And as you know, according to the Bharat NCAP, for example, for the vehicles, there are mandatory seat belt for the passengers. About my work. So when we were doing this work, so we realized that the decision to change the shoulder width was not based on any evidence. And over the year, we when we traced the timeline of the change in the shoulder width, so we did not find any research evidence to change shoulder widths. So there were sometimes increase in the shoulder width for the all lengths, and sometimes there was decrease in the shoulder width for the other lengths. So we wanted to understand what is the reason for this changing the shoulder width, because initially the shoulder width was considered as a capacity enhancement mechanism when the road exceed the capacity. So some of the capacity can be taken by shoulder, but it was never introduced as a safety intervention for the rural roads. So we wanted to understand what is the effectiveness in the context of the India. So for this, I adopted a method which is called case control method. So in the case control method, you usually try to select the segments based on the whether the segment has a crash or it did not have a crash. So cases where there are crashes on the segment, and controls where there are no crashes on the segments. And then you try to match the case and control segments, and then see what are the consequences of different variables, independent variables you have taken in your study on the dependent variable. So in my case, the dependent variable was the fatal crashes. Now, so to understand the effect of different variables on the fatal crashes, I adopted the conditional logistic regression model, which is preferred for the case control studies, and I segregated my data into different crash types. So you can see that I have 4 different types of crashes: all fatal crashes, rear end fatal crashes, slow and moving vehicles, and motorized two-wheelers only. So in this case, I only had the motorcycles. So this is the method to calculate the odds ratio for the different variables that I have taken in my study. So and then based on the chosen significance level, you can infer whether the effect is statistically significant or not. So what we understood from this analysis is that for if we aggregate the all crashes in a single group, so we understood that we found out that the wide shoulder are beneficial, or they have less probability of fatal crashes compared to the narrow shoulder. But when we disaggregate it for the different crash types, for example, rear end crashes, slow moving vehicles and VRU crashes, and motorized only crashes, so you can see that there is a difference in the pattern. So we could not conclude that for the different road traffic crashes, the effect of shoulder width was always positive side. That means the wider shoulder, the safer it is. So this you can easily see that in case of rear end crashes, first it was safe, and then once we further change the or increase the shoulder width, the impact was negative also. So we understood that whenever you try to implement any road safety measure, so there could be 2 effects. One is engineering effect, and other could be behavioral effect. So when you have very wide shoulder, so sometimes you might have observed that some of the drivers, they tend to use it as an extra lane. So these are the behavioral variabilities which we have to understand, and especially from the low and middle income countries, that we need to have more and more research in the context of the low and middle income countries. Because in the high income countries, if you take the conclusion, so these conclusion might be totally different in the high income countries than in our country, than in low and middle income countries like our country. So this was all from my side. Now I would like to open the floor for the questions.
Thank you, sir. That was an interesting talk. Now the forum is open for discussion.
Regarding the shoulder width, in some IRC code, it is mentioned that required width for the broad shoulder is 2 meter, and in some cases it is 2.5 meter. As you mentioned that in some cases, if the wider shoulder is provided, some people used to take it as an extra lane. So what is that recommended paved shoulder width? Any that line?
Yeah, so if you check the recent IRC, so they have recommended the total paved shoulder width more than 2.5. That was the recent base revision. But what my research is concluding that it's difficult to give a single value uh, as a safe shoulder width. So, for example, if you would have noticed that if you take the all crashes at the aggregated level, then it is saying that the wider the shoulder width, it is better, it is safer. But if you take the different road categories, so it is not conclusive conclusion. Am I
Yeah, because maybe what is yeah, seeing some recent notification came in that one value is
sorry,
missing.
your voice is actually breaking. I'm not able to hear you properly.
Yeah, one circular from IRC. In that circular, the specified shoulder width is one value, and in the code there is another value. So there is a confusion regarding that. So when we provide the 2.5 meter shoulder width, no. So some road safety experts are not advising that one. So that's the issue. And just throw some
Yeah,
light on different shoulder, different, say for example, 2-lane road or 4-lane road. In that case, what can be the recommended shoulder width?
yeah. So as far as I understand, so IRC has, as per their recent update, they have advised for the all rural roads minimum paved shoulder width should be 2.5 meter, and then they have also advised the unpaved shoulder width. That value right now I don't remember, but ideally minimum. So that's a challenge because IRC. This is what I indicated in the beginning of the shoulder width study, that it was very difficult for us to uh, understand why there was a sometimes increase in and sometimes there was a decrease change, or that change was decrease in shoulder width. So that was not based on some research studies done in India, but it was based on the IRC committee, even though they might have some discussions on the effect of shoulder widths on the fatal crashes. But right now it's difficult for me to give you this answer, like exactly what would be the safe shoulder width, because we are not just talking about the shoulder width. We want to have a shoulder width which will be safe. So it's a difficult question to answer for me to right now. So there is a question in chat. So how can I open that? And but I could see that chat that what is the paved shoulder width safer?
Yeah, the question is any findings on effect of paved shoulder and shoulder width on pedestrian safety?
Yes, this is very important, I mean, issue, because in our case, in Indian case especially, and although also in other low and middle income countries, we know that lot of highways are passing through the settlement areas or the villages or the agricultural areas, and then there are some pedestrian activity. But again, this question is also what I have not explored, like what is the effect of especially the paved shoulder width on the pedestrian safety. Even though I have done one study on that, so that was also not conclusive. Like what could be the safer shoulder width for the pedestrians. So, I mean, it certainly indicates that more studies need to be taken. So, the study I have taken was done, that was just for the one rural highway stretch, and that was even 70 kilometers. So, to have a generalized results, we need to conduct more and more studies, and then we can say, okay, now we have a concrete evidence based on the research. that what could be the safer shoulder width for the pedestrians and also for the other road users. But yes, certainly there is a minimum paved shoulder width, which is as per IRC now it is 2.5 meter. Any other question?
Professor Joshi, you would like to interact?
Yeah, I was listening to his talk and it was quite interesting. I think there is a larger issue related to number one, the planning of the road infrastructure, considering the needs of all the varieties of road users moving together. And second issue is related to capacity deficit in different categories of roads. He has tried to address the issue related to behavior, but that issue arises because of number one, the deficit in the way we are planning the roadway facilities, and second is the capacity itself is deficient. I think issue is very broader in nature, and therefore it needs a lot of efforts on the sides of the researchers as well as policymakers. Otherwise, it's very interesting presentation.
Yeah, you are right. Yes.
Yeah, this is Samson. That's a good presentation, Laxman. Like I have a couple of points. One is you were demonstrating the speed check, alcohol check, and how that is the accident rates in decreasing. And basically, these things are something connected to the enforcement. Even if you are providing
Your voice is breaking.
hello, am I audible?
Yes, better.
Okay. Now you were mentioning about the speed check and alcohol check and how the speed how we can achieve the targets like that. But basically, this is something connected with the enforcement, like is it not?
Yeah, right.
But
Yes,
that is
right.
that should be now probably will be giving the required paved shoulder or even other geometrics are also perfect. But the enforcement plays a major role in the road safety.
Yes, you are right, Professor Sampson. That's what I indicated, that we need to have multi-pronged approaches. So it's not just that you improve the infrastructure and then you expect everyone to behave the correct way and in the intended way. So we need to have the enforcement as expected by this road system, and we need to have the safer infrastructure, and also as the previous person indicated about the planning process, how we can incorporate road safety in the planning itself. So right now, what are the different construction activities happening? So we need to understand that in what level or the road safety has been discussed in the different stages of the project life, and especially when you talked about a very important issue, that is the enforcement. So whenever we have a discussion during the road safety audit projects with the police personnel, so I mean there is a disconnect amongst the stakeholders. So this is a big challenge for the to solve the road safety. So when we discuss that enforcement is not appropriate, so then we need to also understand like what kind of training they need to have as a road safety police personnel or the road traffic police personnel, and what are their different workloads. So whether we need to have a dedicated traffic police. So if you know that in India, there are certain cities, they have dedicated road traffic police, but some cities and many cities, they don't afford the police. It's a institutional challenge to address.
Yeah. That's correct, Laxman. Now, when you were
Yeah.
like mentioning the Hyderabad the data, around 32.4% is hit and run case. That there again, the enforcement
Yes.
is the issue. Okay, because if you 1/3 of the like in your slide, you mentioned that the underreporting is one issue, and wherever it is reporting, if the run and the hit and run case is more, definitely that is a serious issue to be looked in. And only we can like we can reduce the
Yeah.
number.
Yeah. It's also I also understand it's also the issue of like the data integration. So I'm how because that study took the data from the hospital and they have done the surveys of the victims. So I mean you are right, but it's a larger issue of than just the enforcement.
Yeah, thank you, Laxman. There's probably Ardra, you would like to interact with Sanjay? Bin?
Yes.
Yeah.
Okay, so if any would like to further reach me, so mail IDs can see. So I have provided my Gmail as well as my institutional email. So I'll be very happy to address your questions, or if you want to collaborate. So I'm open for that as well.
Thank you, sir. Now I request Dr. Anila Cyril, Junior Scientist, to propose the vote of thanks.
Good morning, everyone. On behalf of NATPAC, I would like to extend my heartfelt gratitude to each one of you for joining us today for the 13th TransPedia Research Talk on the topic Recommendations for LMICs based on road safety science principles to realize the global targets. It has been an enlightening and interesting session shedding light on road safety. I would like to begin by extending my heartfelt gratitude to our distinguished speaker, Dr. Laxman Singh Bisht. His expertise and insights have genuinely captivated our audience. Thank you, Dr. Laxman, for delivering such an engaging and informative presentation. We truly appreciate the valuable knowledge you have shared with us today. I would also like to extend my gratitude to all the attendees for your presence and active participation. Your questions and the discussions that followed the talk highlighted your keen interest in the subject, and I truly appreciate your engagement. Finally, I would like to thank our director, section heads, and the organizing team for their support that made the smooth execution of this program. In conclusion, I believe we have all gained valuable insights from today's technical talk, deepening our understanding on road safety science principles and recommendations for LMICs. Thank you once again to everyone involved, and we look forward to hosting more such technical talks in this series and continuing this legacy. Thank you all. Have a wonderful day.
Thank you, Laxman.
Thank you.